Hi everyone, welcome to the conclusion of the Living Well with Cancer-Related Fatigue video series. In this final video, we're going to learn a bit more about how to talk to your healthcare team about fatigue and when you should be seeking urgent medical attention. Then we'll hear one last time from Ed and Sandi about what they think is most important for someone facing cancer-related fatigue.
So Ed and Sandi's stories about fatigue are not uncommon. I see many patients in my clinic that have cancer-related fatigue similar to theirs. I also see many patients in my clinic who can very effectively manage and deal with their cancer-related fatigue. So this video curriculum, I think, can give patients all the tools and tips that they need to get started.
So I think that when you're talking with your healthcare provider about fatigue, we'd like to know what activities you'd like to be doing and how the fatigue is impacting that so that we can create a plan together to help get you to that point.
People can use certain ideas or terms to help their healthcare provider understand how important the cancer-related fatigue is in their lives. Talking about things such as how it affects their quality of life, their inability to engage in activities that are important to them, their inability to engage in social activities or social interactions, those might be helpful topics to consider.
Patients, I don't think, should be afraid to talk with their healthcare provider about how they're feeling with their fatigue. There's no bad time.
We really want to be able to help you live with the fatigue. Being able to talk about it and understanding your goals, we'll be able to work together so that the fatigue is managed.
So there are many medical issues that people might confuse with fatigue, but are quite different and warrant urgent medical attention. For example, if you're having sudden change in your strength, in your power, in your limbs, that would be something to let your medical team know about right away. The other thing is people sometimes experience dizziness or lightheadedness and falls, and that is not necessarily related to fatigue either. It could be related to blood pressure, infections, or other issues, but the point being that also warrants urgent medical attention as well.
If someone has symptoms that are above and beyond their normal symptoms, such as new onset of shortness of breath or new chest pain or feeling the heart jumping around or getting lightheaded or dizzy or feeling like they might pass out or having bleeding that's not stopping, those are symptoms that might suggest something else is going on.
I think a lot of my patients expect to have some type of fatigue. They have cancer and they're undergoing chemotherapy. The fact that you have it means that we should be talking about it, and there are a lot of resources for patients to help them deal with the fatigue that they experience.
So as you've seen from Ed and Sandi's story, there are lots of things that you can do to help manage your cancer-related fatigue. I really appreciate that they've, both on their own and perhaps through the help of different healthcare professionals, found ways to take an active role in managing their cancer-related fatigue and improving their quality of life as a result.
My thing is I wake up every day hopeful. And there's nothing I control at all anymore except my response to the things that happen. And so, I respond to the fatigue as something that, again, has taught me to sort of slow myself down and just give that information to family and friends.
Even though we're diagnosed with cancer, it's not the end of the world. We still have to continue living and we still can enjoy life. We can have cancer, but we can still live.
I'm not supposed to be doing this well, I think, with a metastatic diagnosis. And I'm feeling quite well, so hopefully that's inspirational just on its own, that I'm really feeling quite well.
If I had one tip for a person who is going through fatigue after treatment, it would be that you're not the only one. It is kind of normal, and ask for help.
Over the years since my own cancer treatments, I've been able to meet thousands of people who have still been able to live well despite the cancer-related fatigue they have faced on a daily basis. Just like Ed and Sandi. If they can do it, you can do it. You have what it takes. It will not happen overnight, but with the help of your friends, family, and healthcare team, I know that all of you can live well despite the fatigue you are facing. Remember that there are many different types of healthcare professionals that are able to help you, and make sure to ask about the specific resources that may be available in your local area. Finally, I can tell you that my life looks a lot different now than it did before cancer, but I'm happy with where I am because of the decisions that I've made. It's my hope that you will be happy with the decisions you make and do your best to live well. Thanks so much for watching.